A 45-year-old man is brought to the emergency department following a minor traffic accident. At the scene of the accident, the police noted that he smelled of alcohol and was confused. He has consumed 1 liter of vodka per day for 20 years. On physical exam, the blood pressure is elevated at 155/90, as is the heart rate at 102. Jugular venous pulse is also elevated at 15 centimeters of water, demonstrating that right atrial pressure is elevated. The respiratory sounds on the lung exam show diffuse wheezes and crackles, and there's a prominent third heart sound. That's the sound of heart failure, marked decreased compliance or elasticity in the left ventricle. Let's have a demonstration. Here's a normal heart. Lub-dub, lub-dub, lub-dub. Here's the third heart sound. Lub-dub-du, lub-dub-du, lub-dub-du. And the abdomen is distended. The liver is not palpable, probably shrunken by cirrhosis. The distended abdomen is probably ascites, that is fluid in the abdomen, end-stage liver disease. And he has 3+ pitting edema, again a sign of heart failure. On laboratory, he's anemic with a low white blood cell count and low platelet count, quite common in end-stage liver disease. Fortunately, his kidneys are still working well. His creatinine is normal. And the liver function tests demonstrate, of course, marked abnormality as bilirubin is 12 milligrams %. His brain natriuretic peptide, or BNP, is elevated at 2,000, implying significant volume overload. Just to go through the critical points in the story, he's an alcoholic with a huge alcohol consumption for many years. His blood pressure is elevated, not uncommon in alcoholics. Heart rate also, along with the jugular venous pulse and the crackles in the lung and the third heart sound, tell you that there's left ventricular failure. His abdomen is distended, implying that he has ascites, that is fluid in the abdomen, a sign of end-stage liver disease. And, of course, his extremities had edema, also part of the heart failure. He's anemic, has a low white blood cell count and a low platelet count, all of which go with end-stage liver disease. And, of course, his liver function tests are very abnormal, and his brain natriuretic peptide, or BNP test, is telling us that there's heart failure. Here's his chest x-ray. It's clear he's in pulmonary edema. There's lots of excess fluid in the lung, and the heart appears large, although on a PA chest x-ray you can't be 100% certain. The first diagnostic test is an echocardiogram, which confirms that this man has severe damage to his left ventricle. The left ventricular ejection fraction is only 15%. Normal would be above 50%. And he has a variety of blood tests and ultrasounds showing that he has advanced cirrhosis of the liver, and his physical exam suggests also ascites secondary to portal hypertension. So, the diagnosis, pulmonary edema secondary to alcohol-induced cardiomyopathy. Alcohol, taken in large amounts, is a toxin to the myocardium, and taken over many years results in very severe myocardial damage to the left ventricle. If the patient stops drinking soon enough, there can be recovery, but if it's been going on for a very long time, there may be no recovery. Well, to make the patient more comfortable, we give intravenous diuretics to induce a diuresis to get rid of some of the excess alcohol. We have to have alcohol withdrawal monitoring to make sure the patient doesn't go into delirium tremens, and there's a whole protocol for that, a so-called CEWA protocol. And then he needs a heart failure evaluation and management. Probably, since his creatinine is normal, we would use ACE inhibitors, that is angiotensin-converting enzyme inhibitors, or angiotensin receptor blockers, as well as a trial for a beta blocker such as carvedilol. And it would be important for him absolutely not to drink ever again. I tell patients like this, for you, alcohol is poison. So in follow-up, he diureses. He loses 32 pounds over a couple of weeks. He starts on low doses of carvedilol. Lisinopril is an angiotensin-converting enzyme inhibitor. Spironolactone blocks aldosterone, also part of the renin-angiotensin system. And we start with low doses of these medicines and gradually increase. He has a coronary angiogram to make sure he doesn't have coronary disease. It's normal, which is quite common in alcoholics, since cholesterol is produced in the liver. And when you have a liver that's not working, usually the cholesterol is quite low. The abdominal ultrasound confirms liver cirrhosis and ascites, and of course we recommend that he never drink alcohol again.